All right. Well, I'm sorry, do I call you Dr. Covington?
You can call me Stephanie.
I call you Stephanie.
You want to introduce me as Dr. Cody, but don't call me that all hour long. It'll be really
Okay, it'll
creepy.
be weird. Okay.
It'll be creepy.
Okay, let's not be creepy.
No,
Awesome. Well, Dr. Stephanie Covington, thank you so much for joining me on the ODAT Chad podcast.
thank you for inviting me.
I'm so excited. So, as we were just chatting, I have 120 women so far signed up to go through the 12 steps in 6 weeks using your book. I'm so excited.
Yeah, that sounds great. I'm going to want to hear all about it.
Yeah, I'll call you when as we progress and
Okay.
let you know how we're doing. But they are so excited that I'm actually talking to you today. So, and I've been publishing what I call step work calls with several women, and I've been publishing them as podcast episodes, and we've been using your worksheets, and they have been amazing. Those episodes get a higher response than any of the other interviews that I do. So I'm really excited to be talking to you. And at the outset, I just want to say thank you so much for writing this book. How long ago did you write that?
That book was published, I think, in 1994, which means it's old.
It's almost 26 years old, right?
Isn't that something?
So I got sober in 94.
Yeah. So the book,
Wow.
and so it takes usually a couple of years to write something. By the time you write it and you get the manuscript done, you send it to the publisher, it's another year. So it was in the early 90s, really. And but it was published in 94. And
Wow.
I looked at it recently, and because every now and then publishers say, do you want to update something or do a new edition? There really isn't anything in there I would change.
Listen, it
I
is
just,
so good.
it works.
It
And
works, yeah.
women in all parts of the country use it, other countries. So I haven't had any complaints, if you will, about why don't you update it, or this feels tired, or whatever.
Oh.
And no, so I'm not changing it, not at this point.
No, I wouldn't change it. It's working. I mean, so I have a sponsor who introduced me to the workbook
Mhm.
probably 8 to 10 years ago. And I
Mhm.
had already been sober for probably 15 years at the time. I'm not great with math, but you know what I mean.
Yeah.
Um, it had been a stretch, and I found the worksheets to be helpful for me to experience the steps in a different way, right? Because it's easy to get caught in a rut and have established thought patterns. So to look at the steps from a different perspective was hugely helpful. And I've been having girls I sponsor, since I started using them, they use the workbook too, because I find that it's and it's written in a way, the big book and the text I love, but it's also very male
Yeah.
oriented. Yeah.
Yeah. Well, yeah, and the whole idea is, I don't know if you know that for, I don't know, 20 years, World Services has talked about getting rid of the sexist language in the big
Yeah.
book, and it gets voted down every time. And that's part of what motivated me, was all these years,
Yeah.
that discussion. I think I need to write something for women, because I think there's something about having female pronouns and
Uh-huh.
women's stories and women's
Yeah.
perspective that resonates with us differently. And this idea of just translate it didn't seem right for me. So I
Yeah.
decided there need to be something with women's stories, women's voices. And I think
No,
that's why it resonates with women.
absolutely. Yeah, you really struck a nerve. I mean, I know women sometimes early in sobriety who will go through the whole book and scratch out he and write her, that whole exercise. It just
Right.
seems a
The
little,
translation.
yeah, yeah. So, but yes, so thank you for writing the book and the workbook. I have found it to be hugely helpful in my own recovery and the recovery of the women that I sponsor. So
I'm
thank you.
glad. You're
You're
welcome.
amazing. Okay, but just to take a little step back, I'm so
Yeah.
curious about you. Like, how does somebody get from I don't even know where you came from to where you are now, because where you are now, how did you get here?
It's always a question.
I know it's a big question, right? But I'm usually so curious about people's upbringing. How has addiction affected your life? Did you come from parents with drinking issues? Where I believe you mentioned that you yourself were in recovery. So maybe you can kind of give me a little background.
Sure. Well, I'll go quickly. I grew up in Southern California, had not a difficult life, and went to college here, went to graduate school in New York, married a New Yorker, and drinking was very much part of our life. He was a Wall Street person, and so that was our social life, included a lot of wine and after dinner drinks and, cocktails, all that rigmarole. And so very clearly I had a problem with alcohol. And got into recovery, mother of 2 kids, married 2 kids, living on the East Coast. And also knew when I got into recovery that I wanted a divorce, and got divorced and came back to Southern California.
I'm sorry to interrupt you. Did you get divorced right away, or did you wait like the year?
No, well, they told me to wait a year.
Oh, you followed instructions?
No. You don't make any major changes the first year.
That's what they say.
Let's see. I got divorced. I gave up the business I was in. I moved back to Southern California. I got, and everything changed.
Everything in the first year.
Everything. Mm-hmm.
But
I also know why they tell you not to do that.
Right.
I always thought it's because, well, maybe you make bad decisions, which I think is possible. For me, what I realized when all the sort of dust settled is it was so stressful. And I felt like I got back here in California, got through that process, which wasn't simple. And I felt like I put my finger in an electric socket. I just was, and I thought, it's too much. I should have waited. It was just too much change. A lot of it was good. In fact, but even good change is stressful.
Yeah.
And so it was just, that wasn't my hindsight. Could have slowed that down a little bit. Could have slowed that down, but I didn't.
Those are big changes, moving from the East Coast back to the West Coast, divorce,
becoming
everything.
A single parent, just everything.
Came with you, I would imagine. Yes. Yeah. Mm-hmm. Mm-hmm. How old were your kids at that time?
My kids were 8 and 11.
Okay, so that was probably hard on them. Did they go back and forth to visit dad and stuff?
My son was here for a year, and he went back and lived with his dad for a couple of years. Then he came back again. And the kids did go visit, but my son went and stayed and then came back in high school.
Okay.
So in the process of getting into recovery, I realized my parents had a drinking. When I was drinking, I hadn't noticed it. But
Isn't that funny?
Because I drank with them. That was part of what we did.
You drank like them?
Yeah. And then when I stopped, it was like, oh my. And they didn't drink in my childhood, but they clearly each had an alcohol problem. And finally, I convinced my sister that we would do an intervention. And my parents at age 80 went into treatment.
80?
Mm-hmm. And into recovery at age 80.
How did they do? Did they do okay?
They did great.
It's amazing.
Yep, they'd been drinking for years. They went into treatment. They did not have a slip, a relapse. And I can tell you that it changed the quality of their last years. I'm so grateful. Changed of course, family events got easier. And I used to be afraid that my dad would drive after they'd been drinking. It was just scary. Yeah. So their last years were in recovery, which.
That's really cool.
Right. Which was,
that's amazing.
We were all very grateful. Very grateful. Yes. So it's never too late.
It's never too late.
Why would you do that? I didn't necessarily think it would work. It's just that we needed to do one more thing. It's the one thing we hadn't done. That's how I explained to my sister, we've done this, we've talked to them, we've done this, I said, we have to do this. And she said, oh my. But she did it with me. And we did it on a Saturday, and by Tuesday or Wednesday of the next week, they were in treatment.
Did they do like a traditional 30-day inpatient treatment?
My mother went inpatient. My dad was out. Well, what happened is there's no place in the country that will take a couple inpatient.
Hmm.
And the reason is because when they've done it, the couples, they sneak out and have sex. I told them I didn't think we were at high risk. I said,
At 80? I don't
I don't
know.
think it's an issue. I don't know, but I don't think so. So my mother went inpatient and my dad was outpatient. Same
Okay.
program, one inpatient, one outpatient. And
That is amazing. How long had you been sober when they went into treatment?
oh, that's a hard question.
It
I
was after
probably,
your divorce
oh
and
yeah, I was probably 20, 25 years in recovery by the time they got into treatment.
how long have you been sober now?
40 years.
Wow.
Long
Wow.
time.
Girl, you
Long.
look fabulous.
Well, I can't say I didn't go into recovery at 12. Um,
Wow.
yeah, so it's been a long, long journey.
Long
Changed
journey.
my life,
Thank
as
God.
you well know. I
I
mean,
know.
recovery gives you an opportunity to totally transform your life.
And I gotta tell you, I'm an obsessive learner,
Mhm.
and there has been nothing that I have found that is as transformative as the 12 steps. And I'm going through a process. Have you ever heard of Big Book Awakening?
Mm-mm, mm-mm.
It's really intense. And it took me several months to complete step one because I was so resistant to all the work that was required. I thought it was stupid. I was super arrogant, 25 years sober. I
I
know
don't
some
need this.
things.
Okay.
But yeah, no, it's an amazing process. I have come to grips with my insanity in areas that I was blind to. It's the funny thing about denial is, stands for don't even know I'm lying, right? And how do you see what you can't see,
Right.
right? And for me, going through the process, and they told me this when I was brand new sober too, that if you work the steps will work you,
Yes.
a spiritual program and all that. Was that your experience when you yourself took the 12 steps?
Yeah, I think for me, the 12 steps are the transformative part of recovery, not the big book. It's,
Yeah.
I mean, it's the 12 steps. And I really do believe they're tools for living,
Yeah.
that we use them in terms of addiction, but they're really fabulous guidelines in lots and lots of situations. And I can think of many times, including currently, where I thought, if the world operated on the 12 steps, we'd be in a very different place.
Oh my goodness.
Think about it.
Yes.
Think about it.
Seriously.
Yeah. What
I've
if
often
politicians were using 12 steps instead
That's
of
exactly what I was thinking as soon as you said
yeah,
that.
yeah, right. Think about it.
Yeah.
So different. It's a whole different way of seeing the world and behaving in the world. So to me, it's the steps that are the transformative.
Yeah, just magical.
Yeah.
So when you got into recovery, did you do a treatment center?
No, I didn't even know there were treatment centers.
Oh, me either.
I didn't know there was. I didn't know. I just had a bad experience, and for whatever reason, the next morning I got on the phone and I looked up Alcoholics Anonymous and called and found where there was a meeting. I have no idea what motivated me. Just
That is wild. Like you went through in the yellow pages or something that
yeah, yeah,
alcohol.
exactly. Yeah, in
Yeah.
the old yellow pages we used to have. Yeah, exactly.
Yeah.
Yeah, I
And
just
it was so there was there someone local and they directed you to a meeting in your
I
neighborhood?
don't. Somebody answered the phone. I don't know who. Somebody answered the phone, and I asked, and they told me. And I called on a Saturday, and they told me where there was a meeting. I don't know if it was that day or the next day. And I went. And
Did
I
you have
go, so I go to my first meeting, right? And, people say hello, and then they introduce me to this woman who then became my sponsor. But this is, and then afterwards, she was talking to me about, not drinking. I said, well, no, that's not why I'm here. I'm really not here to stop drinking. I just want to drink and not have any difficulties. And she said, well, you might find But stopping is how you know. And then she said, it must have been a Saturday, because she said coming back the next day to another meeting she told me about. I said, I don't know if I can. It's my anniversary. And she said, the best thing you can do for your relationship is go to another meeting.
Wow.
That was
Yeah.
really interesting, you know, but I didn't go thinking I needed to stop.
So you had no preconceived notions of what AA was about,
I knew it
or
was for people who were alcoholics.
uh-huh.
Um, that's basically what I knew. I
Do
didn't
you
know
want
anybody. I
I'm
didn't know
so
anybody.
curious about you said you had a bad experience and called the next day. Do you want what kind of bad experience? Was it like a car crash kind of bad
No,
experience or
no. It was one of those horrible. I had my daughter was going to have a birthday, and so we were delivering birthday invitations to her friends, not putting them in the mail. And some friends said, "Oh, why don't you stay and have dinner?" And I did. And the next morning, when I woke up, I couldn't remember how I got home. I didn't remember where my daughter was. I had a cut across my face. I didn't know how I got it. I felt awful. And when my son got up, he showed me how I was the night before.
what do you
And
mean? How did he show you?
he showed me how drunk I was. I had to hold on to furniture in the wall. And it turns out I
Oh,
fell down. It was an old house that had front stairs and back stairs, and I had fallen down the back steps going up to the bedroom. And I just thought, that's it.
all done.
All done.
And that was your last drink?
Well, no, about a month later, someone had given me a bottle of champagne for my birthday. It was in the refrigerator. And I thought, this is silly to let that go to waste. I'll just, I think I'll just have one glass of champagne.
Right.
Well, that didn't turn out very well. And that was it.
And that
That,
was it.
that was it. That was probably about a month later. And I just thought, obviously I can't manage this.
Right. Yeah.
There is
That
no
was just
one. There was never one.
And I think what is the common experience is that terrible feeling, right? It doesn't matter what the specific circumstances were. It's like the feelings are all the same. Just that incomprehensible demoralization that they talk about in the big book, of the shame, the
A lot of
guilt.
shame. Yeah. Very,
Oh,
very shameful. And
yeah.
I was frightened, I mean, it was, I think, to not know where you've been, what you've done.
I'm familiar.
Yeah. So, I mean,
Yes, I
I
know.
certainly had plenty of that previously, but I think the fact that it was also connected to my kids.
Oh, yeah.
Yeah.
Yeah. A
That's
lot of women have a lot of shame when it comes to being a mom. This idea of we want to be a good mother, and the idea that we might
Yep.
not be is so crushing. It's devastating to think that, I do something that might hurt my kids or make me a bad mom.
There's
Horrible.
so much mother guilt, just generally for
I know.
mother guilt's pervasive. And then you have an addiction problem, you have a drinking problem, and you break your own value system. The
I
thing you
know.
say you won't do, you do. And you think, I never would do that, but you do.
Yeah.
And it's just demoralizing.
Yeah. Very demoralizing. Well, listen, and it's so interesting too, because this is all happening past graduate school. And were you already a doctor by then?
No, I had a master's degree in social work from Columbia. I had lived in California, went to New York, went to Columbia, got my social work degree, married, did all this stuff. And then when I came back to California, I went back to school to get my PhD because I drank all through my master's program and I didn't know if I knew anything. I did. It wasn't, you
That's
know,
hilarious.
I didn't know. I
Isn't that
thought,
funny?
I think if I go back to school, I'll see if my brain works. I'll see if I
Yeah.
know anything, because I drank all through graduate school.
Isn't
So,
that something? So you got your PhD after you got sober.
yeah, yeah.
Very cool. And when did you start getting into recovery work? Did you do it right from the outset after you got your PhD?
Yeah, well, I knew when I was working on my PhD, I was very clear that I wanted to work with women with addictive disorders. That was really my goal.
Yeah.
And so I had I did some work in a treatment program, well, actually a couple of treatment programs as I was going to school. And my dissertation focused on women with addictive disorders. And then I opened a private practice. And, you know, you can't, you say you specialize in that, but think how few people call a therapist and say, I think I have an addiction problem.
Mm. So what do they
Mostly they
usually
come from, or they come because they're depressed, or they come because they have relationships falling apart, they're
relationship
having trouble
problem?
with their kids, or, you know, and then you listen, and very often it's a problem with alcohol and other
I
drugs.
can't tell you how many times I've sat in a room of Alcoholics Anonymous where they talk about how they paid somebody $200 an hour to lie to them.
Yeah, exactly.
Yeah. And it's just, it's the denial, right? It's
Oh, yeah,
very difficult to break through the
right.
denial
Yeah.
until someone,
So I started doing that, and then I started going. I also was going to conferences, addiction conferences, to learn. And I realized I didn't talk much about women at all. So I'd go to a conference, there wouldn't really be much on women. So then I'd write a proposal for the next year's conference and say, I want to talk about this. And so I started speaking about women, women's issues. It just all sort of moved along.
you saw the need and
Oh yeah,
decided to step in.
yep,
That's so
exactly.
amazing. And when I see a lot of people early recovery, it's like when the denial starts to lift and you start having all these epiphanies, and your life starts getting better. Like the level of suffering comes down, your self esteem comes up, your life gets better. You're like, oh my God, everybody needs to know this stuff.
Right.
And I do that too. It's like I want to save the world.
Well, it's I think once we have this kind of a life change, it's hard not to want to share it.
Yeah, it really is. Um, One thing I have never talked about on the podcast is women's sexuality in
Mm-hmm.
recovery. And, I talk a lot about the women's way through the 12 steps, but I saw when I did some research about, the kind of work that you do, and I saw this Awakening Your Sexuality, a guide for recovering women. One of the things I bump up against all the time that I don't know how to navigate is there are so many women in recovery who are survivors of sexual abuse.
Yes.
Like they say, like in the general population, 1 out of 4 women have experienced some sort of sexual assault. But I don't know the numbers, and this is not based on anything other than my own guessing, so obviously not scientific, but I would almost say in the rooms of recovery, it's the opposite. I would say it's only 1 in 4 women who have not been sexually
Yeah.
abused.
Yeah, you'd be closer. Yeah, in fact, that was part of what my dissertation was for my PhD.
Really?
Yeah, I was looking at a comparative study between alcoholic and non-alcoholic women in terms of sexual dysfunction, sexual experience, and sexual abuse. Because what I began to see in my practice was so many women had these abuse histories.
Yeah.
And for many of them, they'd started to use because of that.
Exactly.
Yeah,
Yeah.
and that was very linked. And treatment programs wouldn't touch it with a 10-foot pole.
The sexual abuse?
Yeah.
They won't
So,
talk about it?
well, they do now better, but in the
Oh,
years ago, oh no, we would know this, and I would say something at a conference. We said, well, yeah, but people can deal with their sexual abuse issues when they've been clean and sober for a year. And I would say, well, for some women, the connection is such that they're not going to get a year, and they'd say,
right.
oh no, th- you're just trying to excuse their addiction. No, I'm not trying to excuse it, but I think you have to look at all the pieces in a woman's life. And so a lot of my work has been working with women who have trauma histories. And so, I've written the 12-step book, but I've also written program materials, and all of them talk about trauma, all of them.
Yeah, and I wanted to ask you. I'm going to kind of jump around a little bit,
Sure.
but I'll come back. But I noticed that a lot of your literature and stuff that I saw online was about healing trauma and trauma informed services,
Mhm.
which was a new a new term for me. So can
Mhm.
you explain what trauma-informed services are?
Sure. And there are kind of levels to this. So when
Okay.
people become trauma informed, it means they learn about and have knowledge about trauma. They understand what it is and what typical responses are and so forth. And then there's trauma responsive, is where we try to get programs to learn this material and then adjust their policies and their practices to take it into account. And then trauma specific is when there's an actual intervention for the people being served. So,
Okay.
a lot of people get education in trauma and they'll bring a program into their treatment program, but they don't change any of their policies and practices. So let me give you some examples, okay?
Okay.
A women's residential program. And what they do at night is they do bed checks by opening the door and shining in a flashlight to see if she's in bed. Now think about what that experience would be like for a woman who's a trauma survivor who might have been sexually abused as a child.
Oh my God, I got the I mean, I've heard so many stories. So as soon as you said that, oh my God, Stephanie, that's terrible.
Terrible. So we want people to change their policies and their practices. Here's what you learn. Now, once you know this, here's what you need to do. And you
Okay,
also
so
need to
what's the
provide services for the women who've had these experiences. So there's levels to the work,
Mhm.
okay? Levels to the work. So trauma-informed practices, you learn this and then you work differently. You work
Change
through the
policy.
lens, change policies and practice. Earlier, you and I, before we started the podcast, were talking about the women in prison.
Yes.
Okay, think about a woman in prison who has an abuse history, and they shackle her, they restrain her,
Oh
they,
my God.
okay, so she's totally re-traumatized.
Yeah.
Yeah, and it's getting those places too to change what they do. Not easier said than done, but that's a lot of the work that I do.
Ah, that makes me want to cry.
Yeah,
Because
can you imagine? It's awful.
it's
It's
awful.
awful.
And I listen, I don't know what the solution to that is because I know here's the other thing is a lot of women are really angry.
Oh yeah, yeah, exactly.
I mean, I'm sure you see it. You do work at prisons and things like
Yeah,
that, and they're pissed off, rightly so. But it's like, um, and I listen, I've seen plenty of shows on cops where the women are super violent and stuff, and so they need to be restrained for the safety of the officers and for themselves. But you're right, it's like re-traumatizing. I don't
mhm.
understand how, like, what's the path
Well,
forward from there?
yeah. Well, we try to train officers to understand about trauma, and actually, I have a treatment program called Beyond Violence. It's for women who commit violent, aggressive crimes, and
Okay.
I work with them on the violence they've experienced as well as the violence they've perpetrated,
Mm,
and have them look at their anger. And some people don't realize that their anger really comes from these abusive experiences they've had, and it wasn't safe to be angry.
it wasn't safe to be angry. Yeah, the level of detachment.
Hmm.
It's like I see so many women who, like, I just had a conversation with a sponsee yesterday where she was telling me that she feels worse now that she's sober. And I'm like, of course you feel worse. You're finally in touch with your pain.
Healing.
You're,
Yeah,
you're having a feeling.
right.
Yeah, they're not all going to be good. These are growing pains, and you learn
Yeah.
to adjust. And your balance, emotional balance is restored in time. But yeah,
I
we
mean,
become,
that's what alcohol and drugs does. It numbs us out.
yeah,
I mean,
yeah,
it's for some women, it was a solution to a problem, and then the
yeah,
solution became a problem.
yeah.
And so we have to have other ways. People have to have other ways to comfort themselves,
They
soothe
do.
themselves, other than using drugs.
Absolutely. And I'm so curious about, like, I'm very pragmatic. I love the 12 steps. I love practical, actionable steps. And I'm wondering, I want to circle back to the awakening your sexuality because that
Okay.
sounds so interesting. But for somebody who is, and maybe this relates to that because, like, I don't know how to listen. I'm not a professional. I would send somebody to a professional, but um, how does somebody work through that sexual trauma? Do they have to go to therapy and talk about what actually happened, or?
Well, some of the work can begin without ever talking about what happened. See, people
Oh,
think you have to go. Yeah, the way I've written the programs, I have two predominant programs about trauma and set it up so that women can be in groups with each other and they don't have to discuss the event in order to begin the healing process. And that allows many women to sign up and do the work.
yeah,
So
that's amazing.
and then what really happens in group is the women feel safer and safer with each other. They often share what happened, but it's not a requirement ever.
Okay.
Okay.
What if one lady shares her experience before somebody else is ready to hear it?
Well, one of the things we teach are coping mechanisms. I mean, that's really the key to trauma healing, is that if you're triggered by a sight, a sound, a smell, something in the environment, somebody else's story, you have to have tools to comfort yourself if you're feeling emotionally overwhelmed. So
Okay.
we teach tools. We teach how to do that, things you can do. And they're really simple things, really
Like
simple
what?
things. Okay. Sometimes it's breathing.
Oh, being
Breathing in,
present in the
being
moment.
present. You're feeling overwhelmed, so you breathe deeply like you're smelling a rose, and you breathe out through your mouth like you're blowing out a candle. So we have women learn to do that, breathing in like smelling a rose, breathing out like blowing out a candle. Or sometimes I have little those old bubble things.
Bubble wands.
Bubble wands. And so blowing bubbles is another way to learn how to breathe.
Wow.
Teach them things like there's an exercise called the 5 senses exercise. And if you do this in your mind, and you can do it while I'm talking to you. Okay.
Okay.
Okay. So I want you to name to yourself where you are, 5 things you can see.
Out loud or just in my mind?
Just in your mind.
Okay. It's a
5
podcast,
things.
so I should.
5. Yeah, I know it'll be weird. Well, it's a
Not too much
quiet.
sound. I was thinking cell phone, laptop, coffee mug.
Okay.
Okay.
That's 4 things you can touch.
4 things I can touch. Okay.
Okay. 3 things you can hear.
Okay. Got it.
2 things you can smell.
Okay.
And 1 thing you can taste.
Okay.
Okay. So what this is, it's a simple little thing that gets someone right in the present moment. And in the present moment, you're safe.
Yes.
As part of being triggered by having a sight, a sound, a smell, somebody's story, is you take it in, and if you're a trauma survivor, it can push you back in time, triggering
Right.
memory from the past, and you're flooded by the feelings that belong back here.
Right.
So what if you can get yourself into the here and now, then you're okay.
Okay. And when you're back to the here and now, is there a way to, because I did something called process therapy. I don't know if you've ever heard of that, but the idea was that I had the opportunity to like bring up something, and then she and I would do work together to resolve it so
Mhm.
that it didn't continue to, you know, I'm doing the hand motion on a podcast, but come back and smack me.
Right.
Come back and smack me in the head later.
Right, right.
Is that a thing? Can you really resolve trauma from the past so it doesn't continue to trigger you? And
What you can do is you can learn to manage triggers. Trauma never goes away.
it doesn't.
No. No. Well, think about it.
That's a bummer.
Every powerful life experience stays with us all of our lives. You're going to have life experiences from 10, 20 years ago that are still with you, good or bad. It's the
Sure.
nature of life. It's just the
Yeah.
nature of life.
Right.
So what it is not thinking I'm going to get rid of this, but how am I going to live with it and manage it so it's not managing me?
Okay.
And think about addiction.
Right.
Now, you're not actively using, but your experience of addiction is going to stay with you all your life.
Yeah. And there's a book
That's not a
called
bad thing.
It's not. It's the best
No,
worst thing that ever happened to me, is
exactly.
once told me, because now I'm sensitive in a way to something that other people are not, which makes me uniquely useful.
Right. Yeah.
And that, and I like that feeling of feeling useful, because it means that all that pain I had wasn't for nothing.
But every major life experience stays with us. You don't get rid of it.
Okay, I thought you were going to tell me we were going to magically make this.
No. But there's something called post-traumatic growth.
Okay.
And post-traumatic growth is when someone has taken an experience and they're on the other side of it.
Mm-hmm.
We could use addiction, but I would probably use some other, I don't necessarily, some people think addiction's traumatic. It depends on the person. I don't think it is for everybody. But that then becomes a growth experience. There's something comes out of it that either you feel more gratitude in your life, you're having deeper connection with other people. There's something because of that experience that now turns into something positive. Not that I'd want anyone to have trauma in their life, but it doesn't always have to be seen as this horrible thing that I can never get past that owns me. That's what we don't want women to experience.
Right. It does feel like that we're able, I heard that we, in recovery, you can turn defects into assets, right? And I
Yeah,
almost feel
sure.
like these experiences can be transformed, that
Absolutely.
we can reframe it. We can tell ourselves a different story about what it means, because I feel like we assign meaning to things and then we live under this story that's not necessarily true.
Mm-hmm.
Or
But even
these,
if it is true,
yeah.
so let's take a woman who has a horrible abuse history.
Mm-hmm.
There's no reason that she cannot live a positive, full, joyful life.
Right. Once she comes to terms with how to
Mm-hmm.
manage
Mm-hmm.
her triggers.
Right.
Okay. That's
Right.
very practical.
Yeah.
I like, okay, so
That,
breathing exercise and the five senses exercise to bring you back to the present moment.
yeah, just things that can be comforting, because we do this a lot with people in early recovery because we're taking away their comfort. We're taking away the
Yeah.
thing they've used. And if you don't help people get something else, they'll go back to what they know.
Yeah, you hear all this talk about we need a sufficient substitute, right? Something, a message that has depth and weight.
Yeah.
Yeah.
But we also need some practical things.
Yeah, we do.
Yeah, we do.
Yeah, no, I'm a very like practical type person. And so and one of the big messages you hear in 12-step rooms is the concept of a higher power, or having had a
Mm-hmm.
spiritual experience. And when you were talking about the post-traumatic growth, um, you know, I think I saw an Oprah show where they were talking about near-death experiences, and I related that to my alcoholism. Like that was kind of a near-death experience for me.
Mm-hmm.
Times when I would drive drunk, or I'd wake up the next morning and not know what happened at all.
Right.
I'm grateful that nothing,
Awful.
I was going to say nothing awful happened, but I didn't like get into a car wreck and I was never mutilated. You know what I mean? Like
Okay.
I
You're
hear,
still alive.
yeah, I'm alive and I'm whole and I'm
Mm-hmm.
healthy.
Mm-hmm.
Um, but sometimes those near-death experiences are enough of a wake-up call to set you on a different path. And I feel like that's kind of what it sounds like. The post-traumatic growth experiences are.
Sometimes it's not that dramatic. It it the shift from having a traumatic experience be a horrible 100% negative experience, that shift, sometimes it's not as dramatic as a spiritual awakening, or it can be a really gradual process for a woman.
Yeah,
It's just different for different people.
different for everyone.
Yeah.
Did you grow up with any kind of religion, or do you have a spiritual practice
Yeah,
now? Or?
well, my family were the kinds of families that we went to church because that was the right thing to do. My sister and I hated going to Sunday school, and we would try to get out of it. I remember one time getting married, my mother said, "I'm so glad we go to that church. It just has a nice sanctuary for a wedding."
It'll
That
look
gives
good
you,
for the pictures.
yeah, exactly. So it gives you kind of a sense of
Okay.
religion, okay?
Right. Yeah.
Yeah. So I would say no.
Okay. So no personal
No, it was very,
relationship with God.
it was very superficial.
Yeah.
But it's funny, but I was interested in religion and took a religions class in college and all that.
Yeah.
Um, but through recovery, I got much more interested in meditation and more Eastern
Yeah.
philosophy. And I love traveling in Southeast Asia and going to the temples. And
Yeah.
um, actually, in a few weeks or a month, I guess, actually, about now, going to go back to India for a month. And, it's a very spiritual country, very.
Yeah.
And so my spiritual practices are much more Eastern than Western.
I just recently started exploring Buddhism. Are
Mm.
you familiar with Tara Brach?
Yes, uh-huh.
Oh, I love her. I discovered her podcast. And when I can't sleep at night, I listen to her book called Radical Self-Acceptance.
Hmm.
It's so good.
So those are the things that, and that came to me out of recovery, really.
Amazing. Okay, so that's the foundation of your spiritual
Yeah.
practice is being present and
Hmm.
being kind and loving. That's amazing. I love that. Okay, so maybe this is a hard transition. I'm
Not
like,
necessarily.
right? Because when we're talking about, so I wanted to talk a little bit about, the Awakening Your Sexuality, a guide for recovering women. Because so in the vein that we've been speaking about, like women who have traumatic sexual histories, like how do we transition to, I'll just speak for myself. When I transitioned from pre-sobriety to sobriety, like I began to have like this awareness that my sexuality was a tool for validation,
Hmm.
right? I confused sex and love.
Right.
Like I thought that if I could find the right man and make him fall in love with me, then I would be okay. And if I could make enough money, then my life would be perfect.
Yeah.
As it turns out, I was wrong. Apparently, you can't. I was going to say something obscene, but so you can't have sex to recovery. Like you don't recover through a lot of sexual experiences
You usually get into recovery because of
because of the. Yes, that was my experience. But it was so funny because I get sober and I meet this amazing man, and we've been together ever since. We've been together for almost like, so I didn't listen to any of the advice either. I got into a relationship with someone. I was 5 months sober, but it worked out. We've stayed sober. He's just celebrated 31 years of recovery and whatever. But when I felt loved for the very first time, like all my performance needs kind of went out the window.
right.
And I had a period of, I wouldn't say abstinence, obviously, because I was in a relationship and I was really young. I was 25. But do you know what I'm saying? It's like I had to have this, I was in transition and it was so weird. And I didn't have nobody was talking about their sexuality in early recovery.
That's why I wrote the book, is because what we find is for a lot of women, there are a whole variety of sexual issues.
Yeah.
For women who are in early recovery, they usually have more sexual dysfunctions. Their bodies don't work as well as women who haven't been using alcohol and drugs. Some women have never been sexual, clean and sober.
Right.
There's always been some drug involved. Some women have a lot of issues, body image issues. Some women have been sexually abused. Some women struggle with their sexual identity. Am I gay? Am I straight? Am I somewhere in between? Issues around being a sex worker. I mean, there's just a lot of issues, and then they don't talk. You could go to a 12-step meeting for 20 years and they never talk about
I typically go to mixed meetings, but
it.
I host an online women's meeting, but nobody ever talks about how weird sex is in the beginning.
Yeah,
My first sober sexual experience was so weird.
yeah, because you were present.
I know. And I was in good shape. I didn't have body issues, but I was all in my head. I wasn't in my body.
Mm-hmm.
I was so worried about what he's thinking, what I look like, what, you know what I mean? It's like, I didn't even know what I wanted, or it was so weird. It was so
Yeah, and
weird.
so, well, in some ways you have to think, they talk about emotional development. You know how
Mhm.
they talk about our
Oh
emotional
yeah.
development is arrested at the time we start using. I think sexual development gets arrested.
Oh.
And so that in some ways, when you come into recovery, you're probably sexually younger than your years. So for me, I felt like I went through adolescence again. It wasn't particularly attractive. Adolescence isn't great when you're the right age. It's not great when you're older.
At least when you're older, you can kind of hide it a little bit better.
Maybe.
Maybe. Not
Um,
behind closed doors, you can't hide it.
so, you know, but that's why I wrote the book. And then I wrote the book using about 4 or 5 different women's stories so we could
Ah,
follow along and see kind of what happened to them over the course of recovery.
right.
And they were really composites of different clients and things, but just some of the issues that women struggled with because nobody talked about it.
Yeah, and I'm looking at this. I have the inside of the book cover.
Mhm.
So I was particularly interested in parts 3 and 4. So part 3 is titled "The Power of Choice: Ongoing Recovery," and there's topics in here like choosing a new sexual life, the power to change sexual assets, moving through guilt. Gosh, that's a big one, right?
It's huge, huge.
Guilt about, what I had done, like how I acted out sexually before I got sober, like feelings. Women are so shamed about their sexual experiences.
Yeah, men are women. There's so much. That's the other thing. So much guilt about what was done while under the
Yeah,
influence, and which adds to the shame that comes with the addiction to begin with for women. Which women carry more shame
I
than
do.
men do, both about parenting, both about sexuality, both about
Yeah.
addiction, all of those things. We carry more shame, and it's because society, likes to put us on a pedestal and think women don't do those things.
Yeah, you should be a nice girl. I,
I thought
you
you were, it's funny, I thought you were going to say none.
know, none, no, no, no. Nobody is going to confuse me for a nun. Not with my body mouth. Um, but so I don't know if you have practical ways to resolve shame, but I have found that as I speak about my experiences that I was once ashamed about, like I don't have any shame anymore, I don't think, but because I can speak freely about things that I did, and I don't really feel shame. As a matter of fact, I had decided, well, when I was using, I had decided, actually, when I was a young girl, I decided if I couldn't be good, I was going to be good at being bad. Like Jessica Rabbit. I don't know right. I'm not bad. I was just drawn that way. One of my favorite lines ever. But it was like I was going to own it.
Mm-hmm.
If I was already bad, I decided I was going to own it. And there's like an aggressive, that's like one of the coping skills, right? Is you aggressively own your sexuality. And I see like when I see young girls that are promiscuous, I go, that girl was abused because
Awesome.
she's owning her sexuality in like an aggressive way. And that's what she was taught. And it's just like, it's a lack of self-respect. It breaks my heart. But as an adult, I have found peace by talking to other women, and almost like as we talk about it, it almost normalizes the
See, that,
experiences.
see, I think that's one of the powerful things also about 12-step work and sponsorship
Mm-hmm.
is, and theoretically in therapy too, but there's something about the sharing and realizing you're not alone. There's a funny, maybe you remember this story, it's in the 12-step book, of the woman who had all the shame about how many men she'd slept with. And she told her sponsor, and her sponsor had her get out the phone book and look at all the names of the men she had not slept with.
Oh my gosh, that's amazing.
Isn't that hysterical?
That is hysterical. I don't know how I missed that.
Yeah,
I'm
I
really
think it's
all
a
over
very
that.
fun. I'm sure it's in there because it was one of the funnier stories. And I was talking about that somewhere. I was giving a talk someplace, and a woman raised her hand and she said, "I'm from a very small town in Vermont. It wouldn't work."
That's gold. Oh my God, that poor woman.
But it's that kind of being able to talk about it, laugh about it, and it's not such a get rid of the heaviness of it all.
Get rid of the heaviness.
The heaviness of it all. Yeah.
Yeah. Listen, I could talk to you forever. I want to be respectful of your time. But yes, I'm definitely, so I'm doing the current workshop, on a women's way, but this might have to be the next one. This is really gold. I have to really dive into this. And, I feel like I'm somewhat of a sex expert, but maybe not.
Well, you might be.
I don't know.
Hopefully in your own life.
Right? Exactly. Well, this has been fascinating, and I am so grateful for the work that you do.
Thank
And
you.
I encourage anyone who is curious, where is the best place to go to learn more about your work?
I think probably go to the website. It's just www.stephaniecovington.com. And the website shares, what I do. It talks about what I do. It talks about what I've written. You'll
Yeah,
see.
listen, it's a pretty heavy duty website. I was
Yes,
going through it and
kind
I
of.
was like,
There's a
wow,
lot on there.
you've
There's a
been
lot on there.
busy.
Yeah, I'm very, yeah.
You've been so busy. Like, I was looking at all the books and all the boards that you're on, and wow, you've been very busy. So
Very busy.
yeah,
Very busy.
I wanted to ask you really quickly about
Sure.
what it must have felt like, because I understand that in the UK they named, a recovery house after you, the Covington House. Was that amazing?
It was amazing. It was very sweet and the whole thing was very touching that they're a group of, it's um, a treatment group, and they have a women's residence, and they had started helping women recover many years ago. And then I was coming there and they said, we've actually never been trained. Will you come and meet us and train us? And I did that. And then, I got to know them. And then they said, we've decided we're renaming our treatment program to the
Oh my
Covington.
God.
It was so touching.
Oh.
So sweet.
Oh, well, listen, you have touched so many lives I mean, it would be hard to express just what an impact you had on my life and the women that I work with. And I can't wait to share with you like what comes out of this 6-week workshop that we're going to do using your worksheets. And I don't know. Thank you.
Well,
It's
thank
I
you.
just
I'm glad
appreciate your work.
I'm glad you contacted. I'll tell you a quick thing that
Okay.
when I was a few weeks in recovery and I was feeling so good, I thought to myself, I want to help one other woman feel the way I do. And that's what started this whole trajectory. That thought, I want one other woman to feel the way I do. So I feel very grateful to be able to do work that I love.
Amazing.
So
Well, thanks again. I just appreciate you so much. And thank you for your time today. And I can't wait to let you know what happens with the workshop.
do let me know. I want to hear all about it.
I will. Thank you so much. You have a great evening.
Sure. Bye-bye.
Bye. Okay.
Did we
That
do
was
what we had to
fabulous.
do? Okay, good.
So good. I got goosebumps many times.
Great.
Yeah. So I'll let you know so you know what I plan to do is
So when do you start? When do you start your group?
on the 12th. How funny is that? The 12th month, we're doing the 12 steps on the 12th day.
Perfect.
It just worked out that way. I didn't even plan it. It just happened. So that's when we start.
Okay.
Yes, I'll let you know what happens.
Let me know how it goes.
I will. And I'll publish this. I want to publish this episode on the 100th. You'll be the 100th episode.
Okay, perfect.
Isn't that fun?
Yes.
Awesome. Well, it was such a pleasure to talk to you.
Okay,
Thank you
stay in
so much.
touch. Okay.
I will. Thank
Okay.
you.
Okay.
Bye.
Bye-bye.